the usage of the recent drugs, the fat pill to just you pop it and you can lose weight. Like there are so many drugs which are coming to the market. Who is that patient who is the right one to take these medications? And also, more importantly, who should not be using these medications? Can you please elaborate on that?
So very relevant to this time when we are flooded with all these weight loss medication. So there are weight loss pills and there are weight loss injections. Now, when we say pills, they are GLP-1 tablets, whereas when we talk about injections, Ozempic, Mounjaro and Wegovy will be launched sooner or later. Unlike Western market and Dubai market, where these drugs can be directly bought over the counter, fortunately in India, these drugs will be available only with the prescription. So that's a good part. Now, speaking of your first question, who can take it? So we have to follow the same guideline which we follow for bariatric surgery. Anybody who has a BMI of 27.5 is a candidate for bariatric surgery. So I'm sure anybody who has a BMI of more than 27.5 can take these pills under supervision of a doctor. Now, speaking of who should not take it. So if you are thinking that you will take these drugs for 3 months and you will lose weight and you can stop these drugs, you are not the right candidate, because this is not a quick fix. These drugs have to be taken for lifelong. The moment you stop this medication, you regain weight. The other thing is somebody who has history of medullary carcinoma of thyroid, somebody who has a history of pancreatitis, somebody who has a history of pancreatic cancer in the family, they should not take it. Intestinal obstruction or gastroparesis, which is nothing but the paralysis of the stomach. So anybody who had previous surgery or any symptoms wherein their bowel is not great, they should avoid this medication. And obviously, somebody who is planning to get pregnant, they should not take this medication.